EORTC, the European Organisation for Research and Treatment of Cancer, has been a pioneer in cancer research for over 50 years. Our aim is to improve cancer care, quality of life and survival. We promote and conduct independent patient-centred clinical research across Europe. Clinical research which helps patients like Ilse survive cancer. Diagnosed with lymphoblastic leukemia at the age of 9, Ilse's survival prospects were bleak. Thanks to research coordinated by EORTC, less aggressive treatments that did not require irradiation of the brain were developed. Ilse was the first little girl to benefit from this EORTC innovation. Today, more than 80% of children like Ilse can be cured of lymphoblastic leukemia and lead a completely normal life.
When I realize now that the fact that I have 3 wonderful children and the fact that I have been studying, the fact that I'm having a challenging job, actually it's kind of a wonder that all this can happen to me after the treatment. So I realize probably more than anyone else how important those clinical trials are, because the doctors want to make progress in the treatment of leukemia. For me, it was very important to be in the trial because that's the reason I've not been irradiated. So it's very important that those programs are going on and that the treatments are made better and better for the patients in the years to come.
Once you have cured a mouse, there is still a long way to go prior to treat patients at the bedside. High-quality international clinical research is imperative to develop and validate innovative and more effective therapy to reduce cancer-related mortality for the benefit of all patients.
In the 1970s, those diagnosed with testicular cancer had no chance of long-term survival. Childhood leukemia patients, 10%. Those with Hodgkin disease, 10%. Now, long-term survival for these cancers is up to 90%. This phenomenal improvement is largely thanks to clinical research. But curing or managing the disease is not always the end of the story. Stigma and discrimination in employment, education and insurance can bring their own challenges which need addressing. Here, EORTC is unique in its long-term approach, studying patients' quality of life over years, even decades.
The EORTC headquarters has a wealth of information on more than 180,000 patients. Each of them, over the years, has agreed to participate to EORTC clinical research activities. Unfortunately, and currently, fewer than 5% of cancer patients do have access to and benefit from participating in clinical research. My ambition is to improve access to robust clinical research to as many patients as possible in Europe.
In 1999, at the age of 65, Julian was diagnosed with prostate cancer. After being operated, he joined an EORTC clinical trial of revolutionary post-operative therapies, with far fewer side effects than the usual treatments. The success of this trial benefited not only Julian, but contributed to treatments for many other patients.
I'm 82 now. I feel, well, today, very well. I'm amazed to still be here. They've kept me going for 16 years. And right at the very beginning, I thought I had about 16 days.
Julian is the perfect example of a patient with a long-term commitment to clinical trial. Since he was diagnosed in 1999 with prostate cancer, initially he went for clinical trial to try to improve the outcome of his disease, and now in the last 5 to 10 years it's been to improve his quality of life. And this is something, as an academic onco-urologist working with EORTC, I do value a lot. It's investigating not only the effect of the treatment, but how we can improve the long-term quality of life of these long-term survivors.
In the beginning, I really didn't think I was going to last very long. And it is entirely thanks to the professional help that I've received here, that I'm still around. So I really wake up every morning and think, well, here I am, now what's for today? My only regret is that I retired, when I was 71 or 72, because as I feel now, I felt I should have carried on.
EORTC's network of more than 4,000 oncologists and researchers and more than 600 university hospitals work together in 37 countries, voluntarily. Our 180 staff members lead and coordinate this international research from our Brussels headquarters.
If you look at the developments in cancer treatment over the past 50 years, the results are staggering. Today we are witnessing nothing less than a revolution in the way cancer treatments are developed. Look ahead to the next 50 years and you can expect EORTC to be at the forefront of great advancements and cure of cancer.
EORTC was started by a small group of visionary oncologists in the 1960s and has become a unique pan-European clinical research organization. This has been achieved with the financial support from donors, from cancer charities, and from grants received through the EORTC Cancer Research Fund. When you look at what has been achieved and the means which were given to EORTC, you realize the enormous successes which EORTC has made in improving the life expectancy and the quality of life of cancer patients.
More than 1 in 4 of us can expect to develop cancer, but the outlook may not be as harsh as we think. More patients are cured than ever before. Many others are living longer with improved quality of life. This is largely thanks to clinical research and trials. EORTC is the only organization coordinating European-wide independent clinical trials for all types of cancer. This international approach is critical in providing significant results. As the quantity of data increases, treatments are becoming ever more targeted. EORTC are now able to link patients to clinical trials according to molecular profiles. This precision medicine will play a big part in the cancer treatment of tomorrow. With our aging population, the work of EORTC and the requirement for independent funding is more pressing than ever. I hope you will join me in supporting EORTC in its unique work to improve cancer care for us all. Thank you.